Hello and welcome to the Nurse Rosa's Insights podcast. Today I have a fellow podcaster on as a guest. Welcome, Tiffany Ryder.
Hi, Rosa. Thanks for having me.
I am so glad to have you on today. I've been wanting to meet you since we met online. So,
Yeah, it's so cool to finally get a chance to talk to people that you feel like you already know from social media. So,
right?
this has been a great experience. So, thanks for, inviting me so we can have a chat.
Yeah, definitely. So, I wanted to talk to you here in this format because you're definitely what we would call a healthcare stakeholder. If you've listened to this show before, then you probably know that I mean all human people can be healthcare stakeholders. But Tiffany has a really interesting journey. She went from a young mom to an NFL cheerleader to now a physician associate. And she is doing a lot of the similar work to what I'm doing as far as health messaging on social media. And that's a really important tool. So we have some things in common there, except I definitely was not ever an NFL cheerleader.
I'm sure you did
So,
some other interesting things that you get into on the show.
well, I don't think I've get into it. I did my first of arts was in singing, like opera,
Very
but
cool.
there's that. But you know why I didn't go into it?
Tell me.
I didn't want to be a starving artist because I thought I wasn't pretty enough to get cast in things.
Oh, gosh.
And
And
now I'm putting my face everywhere. So,
I
oh
know.
well.
And here we are.
Yep.
That's so
So
funny.
before we got started, I asked if I could frame the question this way. Um, you may be familiar with the show House, and in it, he says he hired the female doctor because she was so attractive. And at first, she got really offended. But then he said, nobody that beautiful goes into healthcare unless they're damaged. So,
Yeah.
Tiffany, can you share with us your story and what leads to why you're so passionate about healthcare?
Absolutely. First off, thank you. That's very flattering, and I feel like the older we get, the more flattering it is when someone needs to card you at the liquor store or it says something nice. So yeah, thank you. But it's absolutely true. I think it's true for most of us that go into healthcare that there is usually a story behind why someone's willing to put themselves in that position and do that type of work. For me, it was growing up in a community that really most people in the community weren't insured, didn't have access to healthcare at all, and really had, I don't know, a better way to say it, but had sort of a low level of understanding of how to navigate the system and how to get the help that they needed. And it was a really vulnerable place to be. And for me, when I was in high school, my brother had a situation and got really sick and ended up in the hospital. And I remember getting the call and going to the hospital to pick him up and sort of being handed this packet of papers. And the hospital telling my mom and I, well, this is the medicine that he needs. This is the treatment that he needs. And it's all really important. So make it happen and best of luck. And, we really didn't know what to do. I was a child. My mom was actually a nurse. She was an LPN.
Oh,
But
okay.
even as a nurse, you don't necessarily understand the dynamics of healthcare billing and or how
Right.
things outside of your niche work. Or, I mean, none of us do. And
Mhm.
and that was the place that she was in, where she was working her job, taking great care of her patients, but wasn't in a place where she really had this comprehensive systemic knowledge of how to navigate things and being uninsured and being
Mhm.
poor. We really struggled and had difficulty with that. And my brother did not do well and has not been in contact with us. We don't really know where
Mhm.
he is or what happened to him, and it's a real source of pain and difficulty for my family.
Mhm. I'm so
And
sorry.
yeah, so it's like, you know, um when I graduated from high school and started looking at what was interesting to me, that was always in the back of my head, like, you know, how can it be that so many of us just like really have no clue what's going on? I still don't know what's going on. One day when I grow up and I'm big, I'm going to figure this out, and you know, maybe I can change that dynamic for, you know, some degree, some portion of the population. And so that was sort of in the back of my mind. But again, I had like barely graduated from high school and had really struggled, and um, figuring out how to get from point A to point B was challenging. And
Mhm.
so over time, I had my own issues in the healthcare system. I had grown up on, you know, free lunches and some government assistance, and uh, my nutrition was not at all dialed in. I was eating whatever that was in the school lunch, and whatever was on sale at the bread store or what have you. And found myself really in a position where I was low energy, unhealthy. I had gotten pregnant at 18, had a little one at 19. And I remember going to the doctor after I'd lost my maternity weight and thought that, you know, things were coming together for me, and being told that I had, you know, polycystic ovarian syndrome, and I had a blood sugar level that was not quite diabetes, but really elevated. And I said, you know, well, what the heck does that mean? Again, not being the
Mhm.
human that I am now, but being, you know, this 19-year-old kid that had come from a rural place and just really didn't know. And the doctor
Mhm.
said, "Well, it just means," like, I was like, "Well, does that mean I have diabetes?" And she said, "No, it doesn't mean that, but it just means that, you know, you'll be at this level for a little while, and then, you know, we'll give you some medicine." It was metformin was the drug that I had gotten a prescription for. And then, you know, one day you'll probably end up with diabetes, and then we'll deal with that. And
Wow.
that was the conversation, right?
Wow,
And
like you're just destined to be diabetic
I was
someday?
like, okay. I mean, now, you know, mind you, this was 20 years ago, right? So there's some degree of difference in the way that we handle that now. But that was the story I got. And sort of separate from that. So, on a separate track at that
Mm.
same time, I was looking to figure out what the heck I was going to do with my life. How was I going to be exceptional? How was I going to distinguish myself and do something outrageous and fun and challenging? And I had decided that I wanted to try out for the NFL. And I tried out for three different teams that first year. um, I won't say what teams they were actually, but anyway, I didn't make it past the first round for any of them,
And
and
just to dial back real quick, were you a cheerleader in high school?
I was not a cheerleader in high school, but I had been on the dance team,
Okay, gotcha.
and that had been, you know, like a really great social
Mhm.
environment for me. And I said, well, what the heck, like I can try this. And so, you know, I didn't know what happened. I didn't know why I didn't make it. I was disappointed, but
Mhm.
like for me that was really the first time in my life that I'd ever been faced with something that was like seemed like an impossible goal, and I had to confront the reality of, well, now what do we do? Right? Do I keep trying? Can I do hard things? Do I give up? How does this work? And anyway, in the process, I met a dear friend, someone who was probably the age I am now, who said, "Sweetie, you are so beautiful, but I really think if you want to make the team, you're probably going to need to be more active," right? And she's like, got the eyebrows going, and, you know, and if you lost 20, 30 pounds, that might like help you like just look like more similar to the other girls. You look great. Let me know if you need some help. And
Aw.
I was like, well, I don't even know what that means, but sure. So I started exercising and like eating better. And I tell this story to say I wasn't doing any of this to do anything about this medical thing that the doctor
Mm,
had told me. I was doing it for this other reason. And what I
mhm,
found out, which you and I know very well, is that being really active is good for your blood sugar and your insulin
mhm,
levels, and eating, a healthier diet is also good. And so
mhm.
I lost that prediabetes diagnosis, and
Woo!
I know, right? I never had any
Yeah.
issues with PCOS again. And, it really showed me that it doesn't actually matter how well educated your doctor is or how confidently they say something to you. What they say may very well be true in a majority of cases. It may not be true. I mean, but that there's nuance there. And it made me
Yeah.
curious. And so, anyway, so that is sort of, a combination of wanting to find a place where I could help others who had gone through some of the things that I'd gone through. And then also realizing that it wasn't this impossible ideal to achieve. It was real humans doing things, and I could learn to do that, and I could learn to um, practice in a way that still gave people choice and gave people
Mhm,
informed consent, and didn't limit their options to just pharmaceuticals, for
mhm.
example. So
Yeah. I mean, it's really important to know, like, you can make these lifestyle changes. Like, there are plenty of people who know you can make lifestyle changes and they want the pill instead. But
sure.
I know one thing that's been really important for me as like a stroke nurse and educating my patients is that especially after having something like a stroke, please take your medicine right
Yeah,
after. And if you want to address your risk factors like um, lowering your cholesterol and blood sugar and blood pressure and everything, do start those exercise and dietary changes. We'll connect you with a dietitian, make that happen. And then hopefully through that, you can decrease your need for those medications
right.
and go down or off of them, but not to, just drop one for the other. There's a whole education piece. And so I'm really glad that you're shedding a light on that because, I mean, you and I both know that there's a place for medicine and there's a place for lifestyle. And being educated on what that balance is so necessary in order to finding it.
Yeah, I agree with absolutely everything you said there, and I think that I guess the piece that I try to focus on when I talk to patients is, your doctor, your PA, your NP, your nurse may not think to tell you the full breadth of all of your options. Um, because we're busy, right? We're
Yeah.
working in the system, we're doing all of these things. And, something simple that you can do is say, hey, I know that you're saying I should take this medicine. I understand the recommendation. I plan to do it. I don't plan to do it, whatever the honest answer is, right? But
Mhm,
okay, I'm going to take this metformin. But in addition to, or instead of, are there other
mhm,
things that I should be doing, that I should be
mhm,
learning about, that I should be thinking about? And sometimes I know in my own practice, when I have a patient who asks a question like that, I mean, I'm certainly not perfect. I will say, oh my gosh, of course there is. I'm so sorry I didn't think to tell you this before. Here are some things that you can do, right? And I think that we all
mhm.
get in those places with patients where we just, forget to say, oh, yes. And also make sure that you're elevating your feet every time that you're sitting down, or, whatever
Right. Yeah,
the behavior or lifestyle modification
the, uh,
is.
the non-pharmacological interventions is what
Yes.
we call it in nursing
Yes.
because we can't prescribe, but we can teach non-pharmacological interventions.
Yes.
So,
Yeah.
we skipped that part of your story about how you started working in healthcare. So how did that happen?
Oh gosh. So, I was a part of this NFL team for several years here in DC, and it was fun. It was great. But then I had the opportunity to go and dance overseas. There used to be
Oh,
this league, the NFLE. And the NFLE had been, done away with by the time I was going there. But what they had noticed is that the cheerleading team was still profitable. They were still able to use it for
Oh,
marketing and shows and concerts and parades and whatever. And so they there was an opportunity for me to go to Frankfurt and dance there.
Frankfurt,
And
Germany.
yeah, so I
Okay.
ended up in Frankfurt for almost 8 years. And it was like the
Wow.
career that was like, when I grow up, I'm gonna, do medicine, just kept getting put off and kicking the can because I was, I don't know, dancing in Paris and getting a chance to travel. And, we danced at the opera. So we got to do a lot of just really
Wow.
interesting, fun things. But when I was in my early 30s, I said, oh my gosh, like I can hardly get out of bed in the morning. Like I was like
Oh,
dancing with these like, 22, 23-year-old women. And I was just, my body was, had had enough. And I said,
mm,
maybe now it's time. And and so I learned German and actually started going to school in Frankfurt. I was going to go to medical school in Frankfurt
mhm.
and take advantage of the very favorable tuition
Nice.
arrangement they have there. It was like €300 for 6 months, which is like $300.
What? For
Yeah,
med
for six
school?
months of study, and it included your train pass and all of this. So I
What?
was enrolled there. It was a lovely experience, really fabulous education. And then I started getting nervous about getting a residency because the way I understood it is that, well, I was told actually, if I'm honest, that, as an American studying in a medical school overseas, it would be harder for me to get a residency placement in the
Mhm.
US. And
Yeah.
without a residency placement in the US, I couldn't practice in the US. And I got to a point where I said, okay, I can't do this. Like, I got to go home. I got to go home. And so, anyway, so I came home. I found a job doing some research with Hopkins cardiology, which was fun and exciting. And we were looking at not just drug research, but lifestyle research,
Nice.
and that was fun. And then, I was enjoying myself, and they said, "Look, you got to do whatever's next. Like this is not where you're supposed to be. What's next?" And I said, "Well, I think PA school's next." And they wrote me the recommendation letters, and the rest is
Nice.
history. And that's how I ended up a PA. That's how I ended up in the emergency room. Um, Chose to work in rural hospitals because I wanted to be able to see all levels of patients and do whatever needed to be done. And that's how I got here.
And now you're doing more clinical research too,
I
right?
am. I am. Um I really have fallen in love in every way with informed consent, which sounds a little hokey, but it's really true. I I realize that no matter what you call it, that's really the piece that I feel so passionate about in medicine. I feel passionate about helping patients understand what the risks and benefits of all of the things are so that they can choose. I really feel that it's not my job to tell someone what to do. It's simply my job to share this subject matter expertise that I have and then
Mhm.
just say, here it is. And I think you should take these IV antibiotics and you should consent to them because if you don't, I really believe that you will die, right? And
Mhm.
and that's a totally different conversation than saying, well, you have to do this and I'm going to, which I've seen in medicine all too often where people are aggressive and they talk down and they, sort of don't meet the
Without
patients where they are.
explanation,
Yeah. Yeah.
without letting them know the
Yeah.
risk. Well, and here's another aspect too. If there has been a lot of research done of all the medications that we
Mm.
are taking and prescribing
Yeah.
to all the population, and most of that has been research done on primarily men, um, not in women. And so, really, can we even give informed consent on medications to women that were not studied in women?
Yeah. Yeah. I mean, it's exactly that, right? And even if it was studied in women, right? Then you're like,
Side
how could
effects,
I
right?
ever
Risk
pretend to
versus
know?
benefit. Yeah,
Yes, it's always
exactly.
versus benefit, and we know that we know that we know that, the my newest example that I use is the talcum powder, right? That they're now saying
Oh
is
my gosh.
associated with ovarian cancer, and that was, suspected 50 years ago, probably longer than that, right? Like it was,
Really?
yes, years and years and years.
Why
Like
was
they,
it given to, like, everyone?
well, and this is really the question, right? So,
Yeah,
and even if it wasn't known, right? Like even if no one knew, like we've been doing this for decades, and then only now, only recently, it's come to be public knowledge that this is a thing, and I really think that that's possible, with everything that we do. And I'm not saying that people shouldn't take drugs or people shouldn't,
right.
I don't know, put stuff on their newborns' bottoms, but I'm saying that we just don't know what we don't know. And
Mhm.
that is my big message. Even when I have patients who are coming in and really want to participate in a drug study, I say,
Mhm.
look, we've gone through the informed consent form. These are all of the potential benefits that you could get from this medication or vaccine or whatever it is. And these are all the risks that, someone way smarter than me can think of are like theoretically possible. But the biggest risk in this room is something that's not on this piece of paper, right? It's something that we don't even know that we don't know, and we may not know for some period of time. And if that's okay, then it's okay to move forward, right?
Mhm.
But I think that's actually what we're consenting to, with any medicine that we
Yeah,
take
that's
for
a good one.
sure, but also with anything. Like I saw
Yeah,
this,
there's always a risk.
there's always a risk. I saw this tweet. I don't know if you
Mhm.
saw it. But I saw a tweet on, it was talking about the use of these GLP medications. So the
Mhm.
medicines like Wegovy and Ozempic. And
Mhm.
the person said, well, we're all going to regret it a year from now or 10 years from now when we find out, what's happening. And then someone else posted and they said, oh, yeah. Well, all of you on the carnivore diet are really going to regret it 10 years from now or a year from now when we find it. And then someone else said, oh, yeah. And it was like this
It was just
thread.
cascading.
Yes, cascading of like all of these different lifestyle choices that people are making or medicines or whatever.
Mhm.
But watching it, I thought, these are all true. Every single one
Mhm.
of these people is right, right? I mean, maybe not that we'll definitely regret it, but that there is some risk, that there's a whole
Yeah.
host of things that we just don't know about. I don't know anything that
And
we're
everybody
doing.
has to make that choice of the risk versus benefit for them, right?
Yes.
Like, I'm on a GLP-1 and I was pre-diabetic, and
Yes.
I'm not now, thankfully, because I lost 50 pounds thanks to this medication, right? And
Congratulations.
I mean, I'm very thankful for that, but then
Yes.
there are some people who have inflammatory diseases who need to eat in a certain way, maybe the carnivore diet, maybe they need to be gluten-free so they don't end up in the hospital, and so it's just not one size fits all for everybody.
No, and there was a risk to you not losing those 50 pounds, and so
Exactly.
that's really what I think it is. Like, who am I? Who am I to make that decision for another human being? I don't suffer the ultimate consequence of
Right, yeah.
whatever happens if you take something or don't.
Mhm.
It's just my job to be supportive and to let you know all of the things that I know, and to let you know that it's okay to ask questions and to
Yeah.
make the best choice that you can. And so
Mhm.
that's my message that I'm running around trying to to get into the culture and the loop of conversations.
Yeah, exactly. So one thing I loved about working in the ICU on a neuro unit was
Mm,
the culture with the physicians was the only dumb question is the question you don't ask,
yeah,
because if you don't ask, you won't have the answer and you won't be able to take the best care of the patient.
yeah.
And so I have carried that forward, and I ask probably a lot of annoying questions, but oh well.
Those are the
This
best people
brings
to work
me
with.
Right, exactly.
Yeah.
Well, this brings me to my $1 billion question.
Uh-oh.
I could talk to you all night, but let's focus in on your answer to the $1 billion question, which is if you were given a grant for $1 billion, how would you like to see it used strategically to meet the needs that you see to have the
Mm.
most sustainable impact?
I love this question because this is like probably something I do every night when I lay down in my bed and my head hits the
Aw,
pillow. I think
it's reflective.
yeah, well, what is the goal? How can we
Mhm,
move the mission further? How can we do more? So it's really lovely when you were talking about how we know each other and what we have in
mhm,
common. One of the things you said was that we both use social media and social media
mhm,
type content to um, communicate with people and connect
mhm,
and
mhm,
educate people
mhm,
about the things that we think are important. And
mhm,
I found that to be a really effective medium, whether it's 160 characters or a TikTok 60-90 second style video or a long form blog piece. And I've spent the last couple of years investing a lot of time into putting out pieces of content that I feel patients can relate to, that sort of remind them of their responsibility and also their power in the journey of their own health, and that they are the ones who ultimately benefit and ultimately suffer, and that it's our job as clinicians to give them the information that they need and help them facilitate them doing that. And so if I had $1 billion, I think that I would make sure that there was a curriculum in all of the school systems. There were, um, and not the curriculum like the type we're thinking about, the type that you and I create on a
mhm,
weekly basis, right? Something that's attention grabbing and memorable and
mhm,
engaging with access to more information. And, whether that's for students in school or for college students or high school students on, hey, this is what a deductible is. This is what
mhm,
coinsurance is. This is when you go to the emergency room. This is when you go to
mhm,
urgent care. Things like that. I
mhm,
would I would scale that. I'm already doing that
mhm,
for mission aligned businesses and
mhm,
healthcare CEOs and founders who are focused in on patients and
mhm,
getting patients to navigate the healthcare system better and getting better clinical and financial outcomes. But I would
mhm.
do it at scale. And if
Yes.
I had some money left over, I'm a big fan of private practice. I think
Mhm,
that private practice, whether it's independent pharmacy or a private practice primary care, I think that's a really special way to interact with patients that allows people more flexibility and autonomy and
yeah.
individual decision making, maybe a little less paperwork. And I think that I would also want to make sure that medical students and PA students and nurses knew that private practice was an option
Mhm.
and help them figure out how to take that step. So that is
Yeah.
how I would spend my $1 billion.
Aw, just educating the fire out of everybody. I love it.
I hope so. That's
Yeah.
what we do, right?
Yeah, that's what we're doing. I mean, we'll do it for fun. Might as well have a budget to really amplify it, right?
That's what I tell everyone. I say, the way I decided what business to get into was what would I do for free if I won the
Yeah.
lottery, and like this is it. So,
Mhm. Yay! Well, if you ever wanna collaborate, you feel free to reach out.
oh
That's
well, I'm
just
already thinking about it. So,
Oh, good. Awesome. My evil plan is working. No,
yeah, it is.
well, Tiffany, thank you so much for sharing your very hopeful journey. I hope some other people got something out of this. I know I sure did. It's always great to connect with like-minded people, and that's what
Yeah.
I love about podcasts is just getting to know other people that are trying to make the world a better place. So,
Yep. It's my favorite thing too. And I'm always happy to connect with people on social, or if you're a healthcare provider or, a healthcare worker in some way and you want to talk about non-clinical opportunities
mhm.
or, how to do more, how to do different, how to get your mission out. I'm always happy to chat with people. So,
Awesome. And I will have all the links to
yep.
Tiffany's websites and socials
Yeah.
in the show notes. So take a look there. Wherever you are listening, or if you're watching on YouTube, be sure to like and subscribe so you'll know when we have new episodes. I would love it if
I'm
you
going to
could
do
leave.
that.
Oh, yes.
Yes, I
Awesome.
am.
Score. I would love it if anybody would leave a comment. Let me know if you learned something, or if there's another topic you would like to hear more about. And I will see you then in the next episode.
Thanks so much, Rosa.
Thanks.